So, which means she has good EQ. Does that mean that?
No, social popularity does not automatically mean that she has high emotional intelligence or EQ. Because to become socially popular, definitely you need very high social skill. But it is not necessary that she may be having high relationship quotient also, or she may be very empathetic also. Not like that. Because social popularity can be gained from your extrovertness. When you are very, say, attractive personality, when you speak very well, when you are very vocal, when you can attract the crowd, you become socially popular. Equally, if you see virtually also on the social media also, to become popular doesn't require any EQ. So the person who is socially popular has high EQ, it is not the right statement. So basically, ability to understand your feelings and ability to understand other feelings. How many real relationships you have, how many real friends you have, not only virtual. There may be thousands of thousands of followers, but if you come to the real life, what relationship you have with the society? That's very important. Many times, such socially popular people, they may not be very empathetic. They may not be concerned more about the relationship or about the feelings of the others. They just focus on themselves. So it is not they are socially popular people are having very high EQ, so they are so popular. Because we have seen the example, maybe that is of mental illness, but we can say that mental illness also in the root has some sort of emotional uncontrolledness, or they do not deal with the emotions properly, and for a long time, if such thing persists, they become mentally ill. So we are having good example of, say, Deepika Padukone or Sushant Singh, who had mental illness definitely, but they were very socially popular. If they were popular and if they had very high EQ, then they might not have been reached to that particular drastic stage. So of course that's of mental illness, but things happen when your EQ is not high and you just focus on the social popularity. So every socially popular person, or in this case also, may not be because she is having very high EQ, because she is not respecting others, she is not concerned with the others' feelings, she becomes frustrated. So this is not the sign of high EQ, right?
Correct, sir. Very right.
Okay.
Thank you, sir. So,
Thank you.
as we saw earlier, that how a particular adolescent story unfolds depends on the EQ of that child.
Yeah.
So, Dr. Suchit, now Dr. Salim thinks that socially popularity does not mean this child has high EQ. So then, in this scenario, what are the components of EQ you think are lacking in this girl, Anita?
Actually, in this child, there are few factors which are lacking, like self-awareness, where she is actually identifying her emotional triggers and understand how their emotions influence the behavior of other, and recognize personal strength and limitations. So they are also very important, and identify what makes them feel stressed, angry, or anxiety, or happy. So can she understand what they are? There are other feelings and why they are so. So that is very important point. Then self-regulation is again very important, where she should control her impulses and pause before reacting. So that's why we always say 6 seconds pause, which is very important. And that 6 second pause definitely will help you to change your thinking. That is very important. So that's why while controlling impulses, 6 seconds pause should be taken, and she should cope with the stress and disappointment and recover after the emotional setback. So can she manage emotions without being controlled by them? That is the issue. Then motivation, actually it is very important, where the what are the goal setting of the child, and is there any delayed gratification here? I will like to say something, one interesting story, that in US they have studied about gratification. They did that मार्शमेलो नाम का एक उनका स्वीट रहता है, वो उन्होंने रूम में रखा, और 3 या 4 साल के बच्चों को वहां पे छोड़ दिया, और उनको छोड़ने के बाद में उनको बोला कि ये खाना नहीं है, सिर्फ देखना है। तो वो कुछ बच्चे गए वहां पे, ऐसे ऐसे देखने लगे, कुछ बच्चों को 2 सेकंड लगे, कुछ बच्चों को 10 सेकंड लगे खाने को, या कुछ बच्चे 2 मिनट रुके वहां पे। तो वो अलग अलग टाइमिंग्स उन्होंने लिख के रखे, and they followed these children at age of 25 to 30, and they find that those who have delayed their gratification, they were more successful than जिन्होंने immediately खाया या immediately वो उनका gratification रोक नहीं सके. So here it is very important for this child also to delay her gratification and willingness to continue despite difficulties. So can she sustain effort when things become difficult? That is also very important. And then social skill and relationship management. This is again a very important point where active listening is very important, building friendship. And as sir has told, not only friendship should be in real also. That is important. And conflict resolution. And can she manage interpersonal situations effectively? That is again a very important. And responsible decision making. Can she is making thoughtful choices despite strong emotions or peer pressures? Because this is very important to have a responsible decision making, because what you do with your emotion is very important rather than having expressing that emotion. So expressing emotion is okay, but that expression should be in a proper manner, and that should be taught to them with the emotional literacy. So that is again very important, and accept responsibility for the mistakes. That is again very important, and learn from the previous experiences. So that is, I think she should have that things, and we can assess her with the test like PHQ or depression test or even EQ test. There are standardized EQ tests are available, which are there like bar on EQ, inventory, or youth EQ testing, and they are available online. So pediatrician can do the EQ testing also, and refer to psychiatrist if there are psychotic problems or there are any other problems. So screening tools we can actually get for her, and then advise the key questions for the adolescents, and then stay calm, ensure safety first, listen before correcting, and give appropriate choices. So correct you before you connect before you correct. So that is the message you should give in this child. Thank you.
Thank you, sir. You brought up a very important thing, sir, about delayed gratification. आज के Instagram के जमाने में we see that teenagers, as soon as they put up a post, and if they don't receive likes and
मैडम आवाज ब्रेक हो गया.
Lost the connection.
मे बी कनेक्शन लॉस्ट.
Yes.
sorry, I'll just
Yes.
sorry for the glitch. So, Swati madam, now the next question is, how is the social media influencing the adolescent self-esteem?
Yes, good question, madam. Nowadays, the social media has changed the reference point for adolescent self-worth from who am I to how am I perceived. There are many emotions which are attached with it. Yes. First one is the like is considered as is equal to validation or either approval. At 16, peer acceptance is extremely important. For Anita, likes, comments, followers, viewers can become external measures for self-worth. She feels that, and nowadays the other adolescents also feels that more likes means they become so happy, they enjoy And fewer likes means they feel rejected, sad, disappointed, and they becomes unhappy. In our case, Anita's reaction to someone not liking her post may therefore reflect validation dependence rather than simply being oversensitive. Another issue is social comparison becomes continuous process. Earlier, adolescents were compared themselves with only classmates and friends. But nowadays they are comparing themselves with thousands of highly curated images every day. They compare their look, appearance, hair, style, nail, clothes, body shape, and everything. Initially, comparison used to have an endpoint, and now social media comparison has no closing time. Next is unrealistic beauty standards. On digital platform, we observe that edited photographs with professional lighting and curated lifestyles. But this is not everyday life. This may lead to body dissatisfaction, appearance anxiety, excessive grooming, dieting, over and vigorous exercise, constant checking of photographs and notifications. And now other issue is also there. The popularity becomes quantifiable. This is particularly relevant to in Anita's case. In our case, earlier, am I popular was the thing, and nowadays the popularity has become visible, measurable, and comparable. She got 2000 likes, and I got only 500. So, this is the thing in this generation, these people. So, all this creates a paradox. The more socially connected an adolescent appears online, the more vulnerable they may become to online evaluation. Thank you, ma'am.
Yes, ma'am. You really brought out the bitter truth of today's generations, the social media addiction, or whatever you said is so true for these days, that these grooming and extra, basically they feel they live in that virtual world. They've stopped living in the reality. So
Yes.
now, Geeta madam, uh, now we have this child who is very socially popular, but from inside we know that she's not emotionally regulated. How can her parents help her?
Yes. Um, I would like to tell the parents to be more vigilant and more aware. This I tell from experience because I have been talking to a lot of adolescent girls during my counseling sessions, and many of them are from classes 10 and 11. And they are having fake Instagram accounts. Some of them are even uh, promoting and endorsing brands and earning money out of them. So their parents are not aware of all this. And they inform me all this only because of the confidentiality. So the parents need to be more vigilant and more aware what exactly their children are doing. Instead of trying to control them, they need to sit down with them, discuss with them what the child is seeing online and how she feels about it, and not try to ban it totally. And then they have to need
तुम भी बिजी हो गया जी
they have to build the media literacy of their children. They should learn how to recognize the filters, how to identify the curated lifestyles that are being projected to them, and the comparison traps in which they are getting entangled. They also need to find the difference between the popularity through social media and their own self-worth. Then the parents also need to strengthen their offline self. Take care of their sleep. Are they sleeping adequately or that time is going in media? Physical activities for 60 minutes a day are important for adolescents. Inculcate in them the hobbies. Tell them to continue, just continue their offline hobbies. I have seen children as soon as they come to the classes 10th, 11th, and 12th, their parents tell them to stop all their games. If they were playing badminton or going for dancing, all are suddenly stopped. Now study, study, study. No, their offline hobbies have to be inculcated and continued. Then encourage them to meet their offline friends and build competence in other activities also. Please change the slide. Then the parents need to teach them the emotional skills also. They need to practice with them handling criticism, how to respond in a positive way, and how to respond to disappointments of not being liked on the social media, not to equate it with their personal worth. Then they need to set up firmly some boundaries with them through mutual collaboration. Agree on the time they will be using the media, the privacy settings. There should be rules for bedtime and the content also. And the parents have to role model themselves a healthy digital behavior. The goal is not zero social media. It is to raise an adolescent who is emotionally stronger versus the algorithm. Thank you.
Thank you, ma'am. Ma'am, you really brought out a point that we have to teach the child that internal validation is more important than external validation.
Yes.
So now, so as we summarize the learnings of this second case, which is a socially popular skill. So this teenager is popular outside, but she looks at herself in the mirror. You can see a broken mirror because she's insecure from within. So let us not applaud what is outside and let that not decide your worth. Real self-worth comes from within. We have to teach the adolescent to know themselves, value themselves, set boundaries, and choose real connections. You should just be yourself and not a version to impress. Now we come to our last case, which is a case of a very emotionally intensely angry adolescent. Soham, a 15-year-old, frequently argues with his parents. His father says he's become very disrespectful. He gets angry at everything. He yells, he throws, damages things when in anger. But the boy says, nobody just listens to me. They only compare me with my brother. Arguments escalate until everyone is shouting and nothing is resolved. So, Swati ma'am, what I wanted to know is this is a very angry young man. The anger is very loud, but is anger the real issue? Is it the real problem, or is it communicating something else?
Yes, madam, thank you. Yes, it is most likely to be a secondary emotion. It can be the adolescent's way of expressing something Soham doesn't know how to express himself or doesn't feel safe to express directly. Emotion is not a problem, but the expressions, the reaction which he expresses is the real issue. In our Soham's case, his anger may be communicating that I feel unheard, I feel compared and inadequate, I'm hurt, I feel disrespected, I'm insecure, I want more autonomy. I don't know how to handle frustration. I don't know how to communicate when I need. So his statement, nobody listens to me. They only compare me with my brother and my classmates, are therefore an important clinical clue in our case. So, all this may lead to irritability, stress, anxiety, sibling rivalry, loneliness, insecurity, low self worth, and explosive reaction to criticism. So, friends, don't just listen to an adolescent's anger, but listen to what the anger is trying to say us. Thank you, ma'am.
So, very important to see that what is beneath this anger. Thank you, ma'am. Dr. Suchi, how should a pediatrician approach when an angry adolescent is brought into your office with the parents, with all the complaints? Parents are also frustrated, the child is also angry. How would you approach this child?
So actually, a pediatrician should have a very calm approach. So that we are going to see in the next slide. Next slide, please. So actually, we should ask the parents to recognize anger as a symptom of distress. Previous slide. Previous slide, madam. Madam, I think previous slide, we
This
should,
is okay.
yeah.
Yeah,
So
this is fine.
this is 1 second. This is the one which is there now. So where we have to recognize anger as a symptom of distress, which is very important. Then ask the parents to ensure safety, because due to anger they can harm the things, so even themselves also. So de-escalate effectively and identify the underlying cause. So that is very important, what madam was also telling, that we have to identify the cause and establish appropriate boundaries, which is again very important. Next one. Before that, I think calm is first slide, or it is the slide after this
It's
one.
the last slide, sir. It's
So
the last one.
remain calm and respectful, which is very important. I think the slides are not getting properly. Madam, can you sequence it first and second slide, which is the second one?
This is the second one, sir.
Which one? This one is the
De-escalation.
So de-escalation is very important, and pediatrician actually should remain calm and respectful. Use low and non-threatening voice, which is very important, because while doing counseling, we should have that voice note is very important. Maintain appropriate personal space. Avoid sudden movements or unnecessary touching. Reduce noise and stimulation. Allow adequate time to respond. सो आस्क देम कि अरे आप आपका टाइम ले लो, कुछ प्रॉब्लम नहीं है, हम यहाँ पे बैठे हुए हैं आपका सुनने के लिए. सो आइडियली हैव वन क्लिनिशियन विच लेड द conversation, and avoid shouting, arguing, and threatening, as well as humiliating and challenging the adolescent, because this is very important. Why? Because if we counsel them with the arguing or threatening, then the child will not listen at all. So you should be remain calm and respectful, and use low and threatening voice, which is again very important. Next slide.
Yes, sir. Doing next.
So next,
This one.
next one. Here you have to validate the emotion, because instead of only calming down and why you are believing like this, try. I can see that you are really angry. Means now they will accept कि अरे इनको कुछ तो भी समझता है कि मुझे भी गुस्सा आ सकता है, और ये मेरा गुस्से का रिस्पेक्ट कर रहे हैं. So I can see that you are really angry. I want to understand what has happened. आपको क्या हुआ है? Tell me what you think. I need to know. And then validation of emotion does not mean approval of unsafe behavior. उनको ऐसे नहीं करना है कि unsafe behavior किया तो भी हाँ वो चलता है, ये नहीं चलेगा. लेकिन आपको उनका कॉज क्या है और वो कॉज कैसे हम दूर कर सकते हैं, इसके लिए काउंसलिंग करना बहुत जरूरी रहता है. सो पीडियाट्रिशियन शुड हैव दैट अप्रोच. नेक्स्ट वन. सो काम अप्रोच मीन्स चेक सेफ्टी. सो असेस रिस्क टू सेल्फ एंड अदर्स. A is acknowledge, so validate the adolescent's emotion. L is listen, so explore the story and underline the cause. M is maintain the boundaries, so set clear limits while preserving dignity as well as respect. And here you should tell them regarding the techniques which through which they can actually control their anger, like relaxation technique or cognitive restructuring, which is very important technique, that this skill involves challenging and changing negative thoughts and beliefs that contribute to anger. For example, instead of thinking this is always happening to me, you could think this is just a one-time thing. So that type of thing you can tell them. Then communication skill, problem solving skill. So timeout technique, which is again a very important to tell the parents कि जो देने जैसी चीज हो, करने जैसी चीज हो, तुरंत करो. ना बोलने के बाद में, एक ने ना बोलने के बाद में सबने ना बोलना है। और जब वो टैंट्रम थ्रो करता है तो उसकी तरफ पूरा इग्नोर करो। और जब वो नॉर्मल आता है तो उसको ऐसे मत बात करो, अरे तू इतना अच्छा लड़का ऐसे क्यों कर रहा था, ये क्यों कर रहा था, ऐसे कुछ मत बोलो। उसके साथ नॉर्मल आने के बाद में नॉर्मल बिहेवियर शुरू करो। सो दिस टाइप ऑफ टाइम आउट टेक्निक इज वेरी इंपॉर्टेंट, एंड वी विल एक्चुअली दैट विल ब्रेक द फ्रॉम अ सिचुएशन। एंड उसको लगेगा कि अरे मुझे जो मिलने जैसा है, करने जैसा है, तुरंत मिलता है, मेरे एंगर की वजह से वो नहीं मिलता है। सो दैट इज वेरी इंपॉर्टेंट दैट दे शुड अंडरस्टैंड। एंड डूइंग एक्सरसाइज, healthy lifestyle habits, all these are very important. Even 6 second pause also will help here. And that's all I think, which is very important points which I want to tell about the this thing, how to counsel them by the
Thank you,
pediatrician.
sir. Yes, yes. Thank you, sir. So pediatrician himself has to remain calm and use the calm approach to manage this angry adolescent.
Yes.
Uh, Dr. Geeta, madam, how
Yes,
should parents respond when an adolescent is angry?
yes, give me the slide. Well, I would like to tell the parents to first regulate themselves. Because when the parent is also shouting and the adolescent is also shouting, they fall into, an escalation trap. Tell them to pause the argument. If the emotions are running very high, they must pause the argument and create some space. The parents can tell them, okay, let's all calm down and then we'll tackle this issue later on. And then when you sit down to talk to them, really listen. Try to understand the trigger behind that anger and also try to understand the adolescent's perspective. So please change the slide. At the same time, just like Dr. Tamboli was saying, name the emotion and validate it, acknowledge it. For example, the parents can say, I can see that you are very angry and hurt, but your validation does not mean that you are in agreement. At the same time, sit down with them and set firm boundaries for the behavior. See, anger is acceptable, but hitting others, throwing away the things, damaging the property, or abusing others, well, that cannot be accepted. So that's how the parents should respond when the adolescent is very angry. Thank you.
Thank you, ma'am.
Last 5 minutes, ma'am.
Dr. Salim, yeah. Dr. Salim,
Yes,
we saw
yes.
how the pediatrician should handle, how the parents should handle. Now, I want you to give us tips to give to the adolescent for anger management.
Okay. Thank you, ma'am. There are a lot many skills narrated in the books and literature, but few of 3 or 4 important skills that I would like to share with you is one is the remember that the skill is very important because it always serves them rather than hurting them. So recognizing triggers is firstly very important. They should understand. They should be self-aware of what exactly led to the anger and what was the cause. The most simple and easy skill is box breathing. That is to breathe in, then hold, then breathe out, then again hold.
One thing.
The figure shows that count 1 to 4 and take a deep breath, then pause for a 4, 1, 2, 3, 4 count, then again exhale, and then again take a pause. So this is known as box breathing. In a minute, you can do the 3 cycles. And for 2 to 3 minutes, if you do this while being stressed out or while being anger, this will definitely help you to calm down. It's a very well-known and accepted skill that deep breathing techniques helps you to calm down. And then second most important skill is, as Dr. Tamboli also said, that whenever we get anger or whenever we get aggressive, take a pause. That's very important because it's very important part of the emotional skill. If you want to become emotional intelligent, don't react, respond to the situation. So to respond, we need a pause. We need to understand the trigger and we need to think over ourselves, okay, what happened and what exactly we need to do. So that pause will definitely help you. Pause also helps to reduce the adrenaline surge because whenever you become anger, a lot of adrenaline is secreted. So to suppress that surge, to bring you to at the bottom line level, if you take a pause, that will definitely help you. The third technique that is also very known, that is sensory grounding. Like electricity wire, we ground in the earth as a earthing, so that whatever the excess energy is produced will be grounded in the earth. So that is the term used here also, sensory grounding. So if you do this exercise, your all the emotional outburst or all the negative emotions will get grounded. You will become calm and you will become more productive. So in this, what we do that we use all our five senses. First, we try to see five things around us. Then we try to touch four things around us. Then we try to listen the three sounds which are surrounding us. Then we try to smell two important smells that we can smell from the surrounding. And lastly, we think of one taste that we like the most. So this, using all these five senses, will ground your negative emotions and will make you calm. And lastly, the self expression is very, very important. Journaling, there was one question, I think, what is journaling? Journaling is whatever you feel, whatever you have the negative emotions in your mind, just write it down. Take a book, make a diary, and write it down. Like, even writing itself is a catharsis. When you express your all negative emotions on the page, your mind gets calm. You get a soothing effect if you express all the things. Even when RJ, I had listened him, and he was saying that if you have a lot of negative feelings, just write down in a diary, tear the paper and burn it. You will be all right. So that's very important, to express or to journalize whatever you are feeling. Even you can use poetry, you can write the songs, you can use visual art, so that will help to calm you and that will help to be emotionally more balanced and controlled. I think,
Thank
thank you.
you.
This finishes
Yeah.
the skill. We'll
Yes.
not go in much
Yes.
detail. Yes. Thank you, ma'am.
Thank you, sir. You covered up the very good tips, and this is very good to tell the adolescent how to manage. Now we come towards the end of our today's discussion. So this last case of anger is like a tip of the iceberg, and as we've seen that the underlying emotions can be a lot many things. So just don't react to anger. Look beneath the anger. The emotions. What we have to see is that uncontrolled reactions are what we need to the adolescents to develop to control. The key EQ skill is, as Dr. Tambol said, the pause. So if you are angry, take a pause, use your brain, use your IQ, make a good choice, and then you give your response. And this pause creates the opportunity for better choice. So EQ is not about being less emotional. We're not teaching adolescents that you become less emotional, but it is becoming more intelligent about the emotions. So using your IQ to manage your EQ. I would like to say that we have to teach adolescents that every feeling is acceptable, but the behavior is not acceptable. These three stories have one powerful message. That in the brilliant achiever, we saw that intelligence needs self-regulation. In the socially popular teen, we saw that popularity needs self-worth. In an angry adolescent, we saw that behavior needs emotional understanding. So know yourself, manage yourself, and connect better. This is the adolescent toolkit for EQ. Every adolescent needs self-awareness. What am I feeling? Self-regulation. How can I respond and not react? Respond and react, very two important words. Resilience, empathy, and social skills and decision making. Now, I would request all my esteemed panelists to give their final take home message before we wind up the session. Swati, ma'am, can you start with the message?
Yes, thank you, ma'am. My message to adolescents is be smart enough to learn, brave enough to fail, kind enough to care, and strong enough to be yourself. Thank you.
Beautiful.
Thank you, ma'am. Beautiful. Geeta, ma'am?
Yeah, I would like to tell the parents, understand before you judge, regulate before you solve, and empower before you restrict. The goal is not to eliminate the challenges, but to raise adolescents who are emotionally strong. Thank you.
Excellent, ma'am. Thank you. Dr. Salim?
Yes, ma'am. I will like to quote one statement from Daniel Goleman's book. that what really matters for success, character, happiness, and lifelong achievements is a definite set of emotional skill, that's your EQ, not just purely cognitive abilities that are measured by conventional IQ test. Thank you.
Thank you, sir. Dr. Suchit, can you please give your
Yeah.
take-home message?
Actually, mood swings or EQ to mind skills highlights the importance of balancing emotions with the intelligence. And emotional intelligence help us understand and manage our feelings, while intellectual skills help us think, learn, and make better decisions. So, true success comes when EQ and IQ work together. So, guiding the heart with wisdom and the mind with emotional awareness is important.
Superb, excellent, sir. Superb. So I would like to just wind up the session that IQ may open the door, but EQ influences how an adult handles the people and responds when the door closes. Our goal is not to raise adolescents who never fail. It is to raise adolescents who know how to recover when they do fail. Yeah. Thank you.
Thank you, madam.
Thank you.
Thank you all.
Thank you.
So I would
Uh,
like to thank Gujarat
Bye,
for
Snehal,
giving me
bye.
this great opportunity
Madam
today.
Vishal, bye.
Thank you so much.
Yes, madam.
Thank you.
So,
Thank you,
Dr.
everyone.
Sumant
All the
has raised his hand.
viewers
So,
also.
he wants to ask a question.
Yes, sir. My
Yes.
question is that regarding the journaling you have told that let us say this child who has got anger, if we tell him that write down anger on a piece of paper and then burn it, what is what you were trying to describe? Can you please elaborate it?
Yes.
Uh, Dr. Salim, you want to take the answer or?
Yes, as I rightly, I have already narrated that writing down your feelings or writing down your emotions will definitely help you to calm down. The psychology has proved that whatever is there in your mind, if you can jolt out on the paper, either in the form of, say, a paragraph or either in the form of stories or whatever, essays or whatever, that definitely helps you to be emotionally strong. That calms down your negative feelings. It has been proved. And this was just to say that the writing down your emotions or penning down your emotions is basically a catharsis. If you write down these things, you become calm. And if you still want more satisfaction, if you don't have anyone to listen to your emotions, your feelings, you can just write down on the paper, tear it and burn it. You will be okay. As active listening, when we speak out our emotions or our whatever problems we have, if we speak out to someone and explain them what has thing happened, and the people or the person receives you or listens you empathetically, that will also help you to calm down. The same way, writing or journaling will also help you to calm down. That's the understanding that I have made.
जर्नलिंग का
Some,
जो
Time
कामिंग
also.
इफेक्ट है ना,
yeah,
उसको लिख के देखने से ही पता चलेगा.
exactly.
और
वरना
थोड़ा टाइम भी
sometime if
मिलता है
you're
लिखने से.
It also helps in finding
write-
out faulty thoughts also. I
Yeah.
mean, many a times when we start writing, we realize that these fault thoughts are faulty, and
yes,
then
Yeah.
correction can be made when you are counseling a
yes,
patient. That correction can
इंट्रोस्पेक्शन हो जाता है,
Important
insight
way of
मिलती है.
important way
टाइम
of
भी
self
मिल जाता
awareness. No,
है,
we can.
फुल
This is
होने के लिए
important.
टाइम भी मिल जाता है.
Yeah.
और
Important tool for
as
self
good as a
awareness.
box breathing, थोड़ा टाइम मिल जाता है, few seconds करते हैं, तो
Exactly.
रिएक्शन का रिस्पॉन्ड में कन्वर्ट हो सकता है.
Yeah.
और फिर आपको किसी को पढ़ने को भी मत दो, उसको कहीं पोस्ट भी मत करो, उसको चाहे पढ़ा रहने दो, चाहे डिस्ट्रॉय कर दो. It has done its work.
You have to
It
write
is
down.
so good.
Yes. Dr.
Thank
Nischal,
you.
please ask your
Yeah, so congratulations to moderator and all four panelists. Excellent three cases and very good dissecting every excellent emotions. So just wanted to add a few things which I have just come across as today's adolescent IQ is enough to start, but EQ gets them through because same brain and now they have tougher world to handle. Now it has been said that if the parent or a pediatrician give three EQ muscles to focus on, and everything has been shared in this webinar, but I would just like to say it as one, two, three. Naming, not numbing. Instead of don't feel bad or focus on studies, teach vocabulary. Are you feeling disappointed, embarrassed, or angry right now? They are different and need different solution. They say that teens who name an emotion are 50% less likely to act it on impulsively. Second, the things which recently we have discussed, delay, not suppress. Simple practice of 90-second rule. When angry, don't reply for 90 seconds. Walk, drink water, or count reverse. No phones for first 30 minutes after a fight or a bad result. And one repair conversation. Yesterday I shouted, that was not okay. I was stressed about something. So when child definitely says something very good, he really realizes. And third is real world resilient. Some difficult environment in the home is very very important, because what has happened in last 20-25 years, majority of parents have become very passive parenting. They allow everything, and everything is available very easily to the children. So from younger age, if they have been given few responsibilities, like make them captain of the team, or weekend outing will be delivered by them, or caring for a pet, organizing a family, and volunteering becomes a very very important in any volunteer organization. Second, let them fail in low stakes in house. Some task has been given to the teenager, and let them fail, and then discuss with the child that what is going on, how do you feel about failing, now think why you have failed, what different you have done, and this will create a lot of emotional resilient in them child. And then the last important thing is, we as a healthcare provider and a parent should be a role model to our teenager, so they learn from watching and they don't learn from uh, uh, what we say. So what is very very important, that strong EQ makes healthier tomorrow. So resilient and emotional intelligence in these teenagers is very very important, and with few these kind of EQ muscles, we can make them practically understand how they can increase their EQ, because it has been said that a high IQ with low EQ will be topper in the class, but will be type A personality, anxious, isolated, cannot handle failure, burns out in college, and struggle in first job itself. Whereas average IQ with high EQ will do very well in the life, because they know that they don't have that much intelligence. So they will work hard, they will do more effort, and they do very well in the chance. But high IQ and high EQ is rare. So we have to be in average IQ with high IQ, so that it works very well in the life. Thank you so much for giving me time. Thank you.
So thank you so much, all the faculties of today, namely our moderator, Dr. Hiral Nayak Madam, then our faculties, Dr. Suchit Tamboli Sir, Dr. Geeta Bansal Madam, Dr. Swati Popat Madam, and our own Dr. Salim Hirani Sir, for a wonderful, crisp webinar today. And I am sure this will be a guiding path ahead for all the pediatricians, parents, teachers, everyone. So herewith, I am very much thankful on behalf of Gujarat AHA, and I request all those attendees who are still not yet the members of AHA, please be a member as soon as possible, so that we can grow in membership also. And herewith, I am thank you very much everyone, and I am very much thankful to all the panelists. Thank you all.
Thank you so much.
Thank you.
And
Good night.
wonderful presentation by
Thank
each
you all.
and
Yes,
everyone.
it was
Thank
very
you.
So
nice.
much. Thank you.
Thank you,
Thank you.
Snehal Madam
Pleasure.
and Upendra Sir
Thank
and
you.
Samir Sir, for giving us an opportunity to be here with you on this crisp webinar. Thank you very much. Good night.
Thank you.
I
Good night. Good night.
invite you all to
Good
Adolescents
night.
And time,
2026.
Hiral Madam, thank you. So,
timely completion is very, very
difficult and
important, and that
so
is the one
much
part of the
task you might be
EQ.
having since last few days, but it is worth and it is wonderful. Congratulations to you and everyone.
Yes.
Thank you.
Okay, good night.
Thank you,
Yeah,
everyone.
madam.
Good
Thank you,
night.
Samir bhai. Thank you.